Hey there, everyone. If you or someone you know has been struggling with snoring, you're in the right place. Today, we're going to show you how to stop snoring once and for all. Snoring isn't just annoying, it can also be a sign of underlying health issues, so tackling it can really improve your quality of life and your partner's sleep too. So, stick around to learn practical, science-backed tips to help you reduce or even eliminate snoring. But first, what are the things you'll need to complete this task? For the full list and where to get them, check the description and pinned comment below. Now that you have all your tools and materials ready, let's get into it. Get rid of it! Before we jump into the solutions, let's talk about why snoring happens in the first place. Snoring occurs when the flow of air through your mouth and nose is partially blocked during sleep. This causes the tissues in your throat to vibrate, which creates that familiar snoring sound. There are several reasons why this can happen. Obstructed nasal airways. If your nasal passages are blocked or narrowed, it can cause snoring. This might happen due to allergies, a cold, or a deviated septum. Poor muscle tone in the throat and tongue. When the muscles in your throat and tongue are too relaxed, they can collapse into your airway and cause snoring. This often happens during deep sleep, after drinking alcohol, or if you're very tired. Excess tissue in the throat. Being overweight can contribute to having more tissue in your throat, which can narrow your airway. Sleeping position. Lying on your back can cause your tongue and soft palate to collapse to the back of your throat, leading to snoring. Understanding the cause of your snoring is the first step in finding the right solution. Now here are some time-tested solutions. Lifestyle changes. Let's start with some lifestyle changes that can make a big difference. Maintain a healthy weight. If you're carrying extra weight, especially around your neck, it can squeeze your airway and trigger snoring. Research has shown that even a small weight loss can reduce or stop snoring altogether. Avoid alcohol before bed. Alcohol relaxes the muscles in your throat, which can lead to snoring. Try to avoid alcohol for at least 4 hours before bedtime. Establish a regular sleep schedule. Going to bed at the same time every night and getting enough sleep can help reduce snoring. Consistency is key because it ensures that you're not overly tired, which can lead to deeper sleep and more relaxed muscles. These changes might seem simple, but they're backed by science. For instance, a study published in the American Journal of Respiratory and Critical Care Medicine found that weight loss significantly reduced the severity of snoring in obese patients. Address nasal congestion. If you suspect that nasal congestion is contributing to your snoring, there are a few things you can try. Use a nasal decongestant. If you have a cold or allergies, a nasal decongestant might help open your airways. Just be careful not to use it for more than a few days, as it can cause rebound congestion. Try nasal strips or a nasal dilator. Nasal strips, which you place on the outside of your nose, can help widen your nasal passages. Alternatively, you can use a nasal dilator, which is inserted into the nostrils to keep them open. Treat allergies. If allergies are causing your nasal congestion, consider an over-the-counter antihistamine or talk to your doctor about other treatment options. According to a review in the Journal of Allergy and Clinical Immunology, treating allergies with appropriate medications can significantly reduce snoring for those with allergic rhinitis. Change your sleep position. Believe it or not, your sleeping position can play a big role in whether or not you snore. If you sleep on your back, gravity can pull the tissues in your throat down, narrowing your airway and causing snoring. Here's what you can do. Sleep on your side. This is the simplest and often most effective way to stop snoring. You can use a body pillow to help you stay on your side while you sleep. Elevate your head. Propping up the head of your bed by about 4 inches can help open your airway and encourage your tongue and jaw to move forward. You can also use a wedge pillow for this purpose. A study from the Cleveland Clinic found that sleeping on your side significantly reduces snoring compared to sleeping on your back. So, it's definitely worth giving this a try. Consider medical devices and treatments. If lifestyle changes and sleep position adjustments aren't enough, there are medical devices and treatments that can help. Oral appliances. These are mouthpieces that you wear while you sleep to keep your airway open. They work by bringing your lower jaw or tongue forward to reduce throat obstruction. A dentist trained in sleep medicine can fit you for one of these devices. Continuous positive airway pressure, CPAP. If your snoring is severe or related to sleep apnea, your doctor may recommend a CPAP machine. This device delivers air pressure through a mask to keep your airway open while you sleep. Surgery. In some cases, surgery might be necessary to remove or reduce the tissue that's causing the blockage in your airway. Procedures can range from removing the tonsils or adenoids to more complex surgeries like UPPP, uvulopalatalpharyngoplasty. According to the American Academy of Sleep Medicine, oral appliances are often an effective solution for people with mild to moderate obstructive sleep apnea and snoring. CPAP, while more invasive, is highly effective for more severe cases. Snoring might be common, but it doesn't have to be a permanent part of your life. With these practical tips and lifestyle changes, you can take significant steps towards reducing or even stopping your snoring altogether. Remember, it's all about finding what works best for you, so don't be afraid to try a few different approaches until you find the one that does the trick. Thanks for watching. If you found this video helpful, don't forget to subscribe to our channel, share it with friends and family, and leave a comment below if you have any questions or tips of your own. Here's to better sleep and quieter nights.